Welcome to this episode of Health Talks with Dr. Patel, a podcast series dedicated to exploring important health topics through insightful conversations with leading physicians, specialists, and experts across the field of medicine. Today, we're honored to be joined by Dr. John Canales, MD, Interventional Cardiologist here in San Antonio. Please join me in welcoming Dr. Canales.
Hi everyone, Dr. Patel here with Hillside Medical Group. Super excited to talk about cardiology today. We have an expert, someone that we respect in our organization, someone we've been utilizing services from for our patient care for the last 7 years. Dr. John Canales, he is a board-certified cardiologist in Live Oak area, and of course he'll introduce himself. But it's important to talk about cardiology given cardiac disease still remains number one cause of death in United States. It was before I went to training. Of course, it was during my training, and still after 13 years, still remains the number one cause of death. So with that said, let's introduce Dr. John Canales. Dr. John, thank you so much for coming over.
Thank you so much, Dr. Patel. I appreciate the time. I appreciate you being here in our community, a deep-seated a presence in the care of our patients here, and I couldn't say enough in terms of what you offer for all of our patients here in this community. It's a joy to work with you. Understanding the landscape of medicine, and speaking of AI, what we were just talking about offline, is that we need people, right? Yeah. We need good people. We need people that can reach out and you can say, hey, doc, I'm going through this, help me. And I think your organization provides that. I think that the care that you have sort of set the standard for in our community is one in which, an AI can't replace AI app that we were just talking about. So thanks again, Dr. Patel, and thanks everyone out there. And hopefully you guys can take advantage of this, because this is definitely a benefit, both my talk and some of the other talks coming down the pipeline. Is that you have a couple more coming?
Yeah, so we were super excited to do one liver, and now we're coming to cardiology, and we're going down different organs. And the common finding is, the risk factors and comorbidities. So last in the liver talk, we talked about the risk factors that, of course, San Antonio, our nation, world, for most part, deals with is blood pressure, diabetes, and cholesterol. My God, I feel like that audience are going to get tired of blood pressure, diabetes, and cholesterol, but that's the reality of it, right? Everything before we started learning about these GLPs is what we talked about last time, and where these comorbidities became so popular. For you guys, this is bread and butter. My God, you guys have been dealing with this for almost like decades at this time. So
yes, yeah, and that's one of the hallmarks of my practice and our practice. Again, I'm sorry I didn't formally introduce myself. I'm John Canales, interventional cardiologist with the Cardiology Clinic of San Antonio, and we serve a broad scope of heart disease in this community, the San Antonio community, more specifically here at Northeast Methodist. But most definitely in this community and worldwide, and especially national, risk factors for heart disease are very important. And when you start talking about risk factors, these things affect all your organs, everything. And so one of the things that I think you kind of touched on was heart disease, right? Heart disease, just for the layperson, heart disease is any sort of disease process affecting your cardiovascular system. Most of the time people talk about or think about heart attacks and strokes. And those are some of the most deadliest cardiovascular conditions. And those things are things that, we can change, and we can change with risk factors. And so when we talk about risk factors, what's very interesting about risk factors is that the Harvard healthcare system in Boston did a large longitudinal study called a Framingham Heart Study. And so there's a small town outside of Boston that's the name of the town is Framingham, and they took blood samples, they took x-rays, they took CT scans of the heart, and they followed these patients, or I should say the population, over generations. And so back in the 60s, right, when tobacco smoking was everywhere, right, the doctors were smoking, actors, everyone, athletes, they were the first. The Framingham study was one of the first studies to show that tobacco smoke and smoking led to cancer, pulmonary disease, but more specifically, as we're talking today, cardiovascular disease.
Yeah.
And so smoking being the most well established. Now, also from the Framingham heart data was things like cholesterol.
Okay.
Okay. Cholesterol and genetics, blood pressure.
Yeah.
So these are some of the mainstays of things we talk about in the clinic, whether myself or one of my partners at the Cardiology Clinic of San Antonio, here through the Methodist healthcare system. And those risk factors then add up and can lead to that heart attack or stroke.
Yeah.
And so the most common risk factors I just talked about: smoking.
Yeah.
Diabetes was another one that I saw in the study. So if you have diabetes, that puts you at risk. High blood pressure. And again, whether it's our guys at a cardiology clinic or at Hillside, we can definitely let people know what those numbers are. And you guys are already, experts at that, right? That's sort of that baseline understanding what patients come in for primary care, and they immediately get a blood pressure.
Yep.
Okay. So then also obesity, right? Something we deal with. 40% of America are obese. I think you talked about that last time.
Yes, we did.
With the use of these GLP medications to reduce obesity. Inactivity, right? Inactivity is huge now with all the devices. Also family history. So a lot of these things, and again, if I forgot one, obviously being on camera, you can forget things, but those are the main 6 to 7 risk factors that can lead to heart disease. If you have 3, you're at least 20% increased risk of heart disease events within the next 5-10 years.
Yeah.
So, those things we kind of nail down with patients as they come in. You treat them every day with their diabetes medications, with the cholesterol medications, right? And trying to reduce blood pressure. Yeah.
So, and you're right. So we've done an internal study of our own organization because we see what the patients are coming in for. It's shocking. 2 out of 3 are diabetics.
Wow.
80% have a history of hypertension. And of course, when you're dealing with hypertension and diabetes, you're also dealing with high cholesterol at the same time. It's shocking. And that's the San Antonio population, though, right? I always say we love our tacos. They come with challenges, right? So that's what we're dealing with. Now, prevention, though, right, John? Because one of the things that we're noticing, and I'm sure you guys are noticing as well, these used to be risk factors when I went to training, at least, was age greater than 50 is when you really start thinking, oh my God, now we're dealing with blood pressure, diabetes, and cholesterol. We're noticing this is happening at a younger and younger population, right?
Yes.
I'm hearing stories of folks in their 40s having heart attacks, or 40s. We're noticing, a lot of patients coming in with those triad of illnesses. Of course, that has nothing to do with the fast food restaurants all over the place, right? But is that what you guys are noticing, that the population that we're caring for with these risk factors are becoming almost younger? Of course, on the other end, I'm also seeing that when we're controlling them, the patients are living longer, which is always great to have with the technology, medicine advancement. But is that also what you were noticing, that the population is getting younger? And
right.
younger?
Right. I think that was actually the 7th risk factor that I didn't mention, age.
Yeah.
An interesting fact, though, I think, understanding, and I was reading this actually this morning, that if you make a change, between the age of 45 and 64, and you do 3 things, or I should say 2 things. One is diet and one is exercise. In that age population, quote unquote young, right? Rarely has seen a doctor prior to this. If you can exercise 20 minutes a day, you can maintain a normal, healthy weight and reduce cholesterol intake. With those things, you can drastically increase your survival. You can reduce your risk for heart disease. You can reduce your risk of cancer. You can reduce your risk of also stroke and dementia. Right. So when you're talking about the aged, right, we get into the cancers, right, talking about cancer and prevention of cancer, and then also preventing dementia. And so in terms of nutrition, it all boils down to a couple of things, which is the exercise and nutrition. And you had talked about the tacos. But I was looking up some data, and I'm just referring to my notes here, but 5 servings of fruit and vegetables per day. Okay, 5 servings.
Yeah.
Walking 20 minutes a day, not smoking. I forgot to mention not smoking. That reduces your risk of dying, okay, by 40% in your lifetime.
Oh my God.
Okay, so it's that simple, right? And so when we talk about the diets and prevention of disease, it's all connected.
Yeah.
That inflammatory pathway in which fast foods, saturated fats, trans fats, and cholesterol intake, it starts this cascade.
Yeah.
It affects your liver. It affects your brain.
Yeah.
It affects the cancer-causing cells, the carcinogens in your body, and most definitely atherosclerosis.
Yeah.
And so atherosclerosis is the cholesterol buildup in your arteries, which are the fuel lines to your heart.
Yeah.
And that process causes hardening, as many lay people understand, the hardening of the arteries, and which can then lead to narrowing and a heart attack. Yeah. And so you're right on. You're hitting the nail on the head. And we see patients in their 30s and 40s who are quote unquote healthy.
Yeah.
And I think understanding the value of the medicine of your diet is critical, and how processed foods, how cholesterol intake with meats, dairy, okay, and the saturated and the trans-saturated fats really influence, and they really speed up this process. And if we reduce those, we can do a lot for cardiovascular health, or for health in general, and just living well.
Yeah. When 2 doctors sitting in the same room educating patients, of course we're going to go back to diet and exercise, right? And that's where it really comes down to, is focusing on your health, but not when we're reaching our 50s, but let's get started at a younger age. 30s is a great place to get started. Annual physical is it's such a valuable tool. Just coming in annually just to get your blood pressure checked, what your cholesterol looks like, and not to mention it's a free service, right? So it's a free.
Wow.
Yeah, so every insurance would pay for annual visit where you're getting these done. Diagnosing earlier, of course, you're going to get annoyed. Your doctor's going to say, work on diet and exercise, but at least it can avoid starting the medications and eventually avoid becoming a risk factor of a heart disease, stroke, or liver disease, kidney disease, and everything in between.
Yeah, but I think primary care, a subspecialist like myself, we lose sight of that.
Yeah.
Where it starts that early.
Yeah.
We generally will get patients later in age, and like I said, we're getting patients much younger. But in your shoes, you see the first patient in their first sort of medical care interaction, and that interface between your practitioners and your physicians is critical. And you guys do a great job of educating. And there are medicines, most definitely. We can start with prevention, which is always the number one treatment strategy or prevention strategy, but medications can help. And so we always get the questions, right? Hey, Dr. Canales, and I'm sure you get them too. Hey, Dr. Patel, what is going on with these statins?
Yeah.
Do the statins, are they causing cancer?
Yeah.
Are the statins causing dementia?
Yeah.
Should we take them? We hear it all the time on social media.
Yeah.
The GLP-1s, the Wegovy's and Mounjaros and these medications. Most definitely. Should we take them?
Yeah.
Are they just the drug company pushing pills at us, or doctors pushing medications to us? But we do see a lot of great data with statins in terms of prevention of heart disease. And then most definitely what is to come, and at least the most recent data from the medications, the diet-related medications of the GLP-1 receptor agonists, is that there is very good cardiovascular prevention.
Yes.
Yeah.
Yeah, we're excited to see what GLP is doing across all organs and specialties. But certainly I was looking at that, and cardiology, it's making some great outcomes are leading our way. And you're right, we hear about the medications all the time. Oh, doctor, they're just pushing more medicine. I was like, the option is do the hard part, which is work on diet and exercise, which again, though, Dr. Canales, I don't think that's always an option for every patient either, right? I do have some patients that work very hard on diet and exercise, but the genetics also kick in where they're just not getting the same benefit just by diet and exercise, where medication is just necessary for them. And then I have to have a conversation. Well, the other option is we just take a risk with the heart attack. That's never a good option.
No.
Which means that's the position we have to put in. Everything we do in medicine is always looking at what are the risks versus the benefit to our patient. We're never looking to take unnecessary risk on our patient if the medicine is not able to offer some sort of a benefit of decreasing risk or survival rate. Survival being, of course, they're going to live longer. So many changes coming through in cardiology, though. I am learning. I'm only 13 years out of training, which doesn't seem like a lot in a medicine field. But I'm noticing heart failure guidelines have changed all of a sudden now. The ejection fraction is not 55% anymore. It's dropped down. And then, of course, I learned more about, we used to talk about medications like Farxiga, but now the GLPs are making that it's awesome to have you on our panel so we can continue to learn from this on making changes for our patients' care. Okay, so we found patients with the risk factors, and I refer, which we've been doing it for 7 years, I feel, since the first time we met. And thank you so much again for taking care of our patients.
You're welcome.
Your entire group, but of course you specifically as well. But we send the patients out, we initiate the referral. What is it for them to expect from the time the referral arrives from your staff's in basket to their day of the appointment?
Right, and I appreciate, again, Dr. Patel, most definitely your expertise and your footprint in this community. And we've had our own footprint here with the Cardiology Clinic of San Antonio in association with Northeast Methodist. And so, again, we service all major insurances as well as Medicaid, which is something very rare. And so, essentially, when patients want to come see us, they can call and make an appointment, or they can come through their primary like yourself to send that referral. So generally we have referral coordinators much like every other office, but you would expect to see a cardiologist, most definitely board certified. That's a requirement for us. And which will start with either a general cardiologist or a general/interventional cardiologist like myself. And so an interventional cardiologist is somewhat different in the sense that we are able to fix the blockage. We're able to look at your cardiovascular disease in your neck in terms of the carotid arteries to see if you have any buildup with the blood flow to your brain or to your legs. And both of these things you guys are doing a great job and ahead of your colleagues in the sense that you perform those studies here in your office so that when we get the patients, we have your referral and it goes through our referral center. We have data. We have an echo, which is the sonogram of the heart, echocardiogram, a carotid artery ultrasound, which you guys do and which looks at those arteries, and also data referring to what your arteries in your legs look like. And so all these pieces come with this patient and allow us to give our best piece of advice and inform that relationship with patients. And back to before we move on with this, but back to your thought on prevention and identifying the patient early. You guys do a great job of using other technology. And so if you're young and don't have any risk factors, that physical, that first medical contact is critical, but also using things like a calcium score. Right? Calcium score. You use a lot of the calcium scores.
Yes, we do.
So tell me, I know I use it, which is actually very rare because they already come to me with all the information. But I think that's important to understand and utilize in your population of patients, which are the young patients, most definitely. And the older, you guys do a great job, meaning the Hillside group does a great job of identifying patients at risk with labs and ultrasound. So tell me how you use a calcium score and I'll give you my input.
And great catch on that. So we get a lot of times patients saying, well, I did my ultrasound of the heart, I did my carotid, and we do peripheral cardiology. I think it was one of the boards from cardiology published a data that PVD evaluation, it's not only when they start having symptomatic, but then if they have risk factors of age greater than 50 with a history of high blood pressure, diabetes, and cholesterol, you should be screening them for it because it's the whole point is prevention, right? So before it turns into, by the way, also when the heart blockages happen, doesn't become symptomatic immediately with that 5, 10, 15, 20% blockage. It actually is 70%, right, Dr. Canales?
Yes,
So
70% buildup.
we're trying to prevent before it gets to the 70% or in that time frame. And if it gets to the 70% and you start having symptoms, that's when Dr. Canales is like, no, hold on. Before it kills the heart cells and turns into scarring, I'm going to go and fix this so it avoids that whole damage and scarring from happening. Does that sound about right?
Yes, that's correct. And that preventative piece in terms of, first, number one, identification.
Yes.
Right. Identifying with labs in that first physical, excuse me, on an EKG or the calcium score, which takes a picture of your heart and gives you the amount of hardening.
Yeah.
And so that hardening, it leads to significant narrowing.
Yeah.
And so that's like not taking your car in,
Yeah.
right? For the regular oil changes.
Oh God,
right?
The doctors and the oil change scenario. I mentioned the oil change last time. Now you're bringing it up. But yes, you're right.
Yeah, but taking care of anything,
Yeah.
taking care of your family, you need to maintain that. You need to, foster the growth and enable a healthy car, a healthy relationship,
Yep.
or a healthy body.
Yep.
And I think that's very important to understand and identify early. And peripheral vascular disease, PVD, or in our case, peripheral artery disease, is something that we can identify because, as you stated, if you have blockage in your heart, you're going to have it in your brain and in your legs.
Yeah. Yeah.
Mm-hmm.
Calcium score. So sorry, I was answering that.
Yeah.
And then but just because it's so important for folks to recognize normal finding is actually, we're happy with it.
It's great.
It's great.
It's amazing. Yeah.
It's like, so when we're doing
Thumbs
the work,
up, yeah.
Yes, so when we're doing workup on anything for that matter, right? A normal finding is something we're super happy with because abnormal is where all of these other things start on how do we go and fix it. More invasive stuff start. So normal finding is a good thing, but screening and staying ahead of it to make sure that when that scale changes, then you're readily available before the damage happens. Calcium score. So young folks, I think the age, I would say less than 50 again. We're always in our fields, we're always breaking it down based on the risk factor. That 50 seems like the plausible area where a lot of times we say less than 50 young population with no risk factors. Let's go and see if we can do calcium score and then start building their case on that. But to be honest with you, give us more understanding of
so calcium scores. So the things with testing that are critical for everyone, right, is it easy to do?
Yep.
Is it available? And is it cost efficient?
Yep.
And so our cost, it's not excessive costs, right? So if you get into cardiology office, you're going to have a lot of testing.
Yep.
That's probably going to be very expensive because, as you can imagine, how important the heart is in into the whole automobile, so to speak, or the human body.
Yeah.
But most definitely, calcium score is a starting place,
Yeah.
right? EKG is fast and easy and cheap
Yep.
to do.
Yep.
And so that takes 2 seconds,
Yep.
right? A calcium score is you go to a radiology imaging center, and a calcium score is relatively cheap in the grand scheme of things.
Yep.
And it can easily take a picture. But identifying that patient, so less than 50 with no symptoms,
Yeah.
and most definitely at least one risk factor.
Yeah.
And so if you're saying, well, I had a family history, that's a risk factor.
Yeah.
I'm obese, right? With your the circumference of your waist size greater than 35 or 38, then yes, you meet criteria for being obese. You're sedentary.
Yeah.
Okay, well, that's a risk factor. So all of these things that people just sort of overlook, I think you hit the nail on the head yet again. I keep saying that, but to say we have an opportunity, and you guys have set down the blueprint for that opportunity of identifying these patients early for prevention, so they don't end up on the meds, right? Or in our office, in the cardiology, or in the hospital, the ER coming in with a massive heart attack. Yeah.
One more thing to what you mentioned out of your list, I would just throw in non-invasive. I mean, you and I, we talk about non-invasive versus invasive. Non-invasive is something we do not need to penetrate your skin to do any of these tests. EKG is so simple. Few stickers, you're gonna have a little glue on it after you're done with it. We may pull few hair, right? But EKG is so simple, gives so much data. And again, just the first step for us as a primary care to recognize, hey, you know what, let's put a pause on it and let's bring it over to cardiology because this is important and this needs to be addressed. So awesome. To summarize, you mind giving us a little more information about your office? So if of course, we'll refer the patients over to your group and yourself. But in case if they wanted to just find you from Google or somewhere, how would they go about finding you and booking appointment?
Right. So Cardiology Clinic of San Antonio Northeast. You could easily type that into the Google bar, AI search methods. We're located right next to Northeast Methodist Hospital, which is Top Rewine and I-35. The office, what's amazing is that these big healthcare systems, more specifically Methodist, has allowed us to move into a brand new building. And so they have new construction, the hospital's expanding its services, the hospital's getting bigger, and we have a new office building, and that's 12500 Judson Road.
Awesome.
And so our phone number, if you want to try and make an appointment, is 210-967-0096. And again, the Cardiology Clinic of San Antonio. The Cardiology Clinic of San Antonio is associated with all the Methodist healthcare facilities. But again, if you're having things like chest pain or shortness of breath or swelling on your legs, those could be signs or symptoms of cardiovascular disease. So those are things that you guys talk to your patients about. But in terms of the broader audience of patients on the different social media platforms, I think understanding those types of symptoms. Number two, knowing your numbers. I always tell patients, and you pound it into them, knowing their numbers. They have to know their numbers, their blood pressure numbers, their cholesterol numbers. All of their blood tests are important. And those are definitely two major risk factors. 1 in 3 Americans has heart disease. 1 in 3.
And not changed in the last 30 years.
1 in 3. And it's the deadliest disease in America. Okay, it far exceeds colon cancer, breast cancer, all other causes of death. And so it's everywhere. Right? Right now there's 2 of us, but if there was a third person, there is actually a third person in the room behind the camera. One of us will have heart disease. It's shocking.
It's me. I'll take it.
It's shocking. No joke. I had my blueberries this morning, so making sure the anti-inflammatory effects of blueberries definitely can thwart that. But so definitely reach out to us. Online, you can make appointments online. You can call in. You can request for myself. Again, I have several other partners, male and female, who speak several different languages, which is great. If you have those issues, those symptoms I was talking about, severe chest discomfort, severe shortness of breath and swelling on the legs, those are some of the main symptoms. Come into the ER, Northeast Methodist. Don't try and squeak into a doctor's appointment. Come in immediately. If you're feeling like this is catastrophic, it's like your car again. If you see a red light that occasionally comes on, we kind of ignore that. But if it's red and there's smoke coming out from the hood, right? Or red and the wheels, right? Take that car into the Northeast Methodist ER. And so we'll be there, either myself or one of our partners. We're on 24/7 at the hospital. And thanks for having me with my scrubs on today.
No, of course.
I have a procedure and actually a heart catheterization, which we can probably get into at a later date in terms of procedures and tests that we do. And we do all, myself included, I do all work in terms of invasive work. You talked about invasive tests, invasive angiograms of the legs to see if you have arterial blockage in your lower extremities, your upper extremities. I do interventions of the heart, complex interventions. And so that's the bread and butter of it all. And it's been great discussing all these things with you today. I appreciate your time.
Thank you so much for coming over. Thank you guys for viewing this. And we're going to continue to bring in more specialists to discuss various topics. So we look forward to seeing you next time.
All right. Thank you. God bless.
Thank you for joining us on this episode of Health Talks with Dr. Patel. See you next time.